How to finally end your fibromyalgia nightmare. Hello, I'm Dr. Vicki Kelsey. What makes me different? I treat patients neurologically and metabolically. No stone is left unturned to determine the exact cause of your chronic health condition. We use neurological treatments based on specific neurological testing. Our first treatment is oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we will help you heal faster. By using exercise with oxygen therapy, we can increase the firing to your brain. By increasing firing to the brain, we can help many chronic conditions. Number 2, we use brain-based therapy. We use specific brain-based therapy, visual, auditory, and motor stimulation to increase firing of the brain. Vibration therapy. Vibration fires the back part of the brain called the cerebellum. One of the functions of the cerebellum is control of the spinal muscles. We may also use auditory, visual, olfactory, and caloric stimulation to increase the firing of the brain. Number 3, flexion distraction therapy. This creates a negative disc pressure and helps to remove pressure off the nerve. It also provides a slow stretch of the muscles, which fires up the spinal cord to increase firing of the brain. Then we also use metabolic treatments based on specific lab panels. We use specific blood tests such as a thyroid panel, a complete metabolic panel, a lipid panel, and a CBC, or complete blood chemistry with autodifferential. We can assess your thyroid, adrenal, blood, and gut function. All can be affected with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you to heal faster. The complete metabolic panel allows us to check, among other things, your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. Adrenal stress index. We can further test your adrenal glands with a test called the adrenal stress index. Your adrenal glands are your stress organs, meaning that they react to stress. If you have been or are currently under stress, this test is a must. This test will measure your cortisol levels, which is very important if you suffer from insomnia. When your body's cortisol levels are abnormal, you will suffer from insomnia. Cortisol levels can be corrected by specific nutritional protocols, and then this will help cure your insomnia. We may test to see if you have an autoimmune disease. An autoimmune disease is where your immune function attacks a particular area of the body, so we test for specific antibodies to determine if you suffer from an autoimmune condition. Tissue antibodies. We can check for gluten antibodies, tissue antibodies to myelin, the fatty sheath around the nerves, or cerebellar antibodies. The cerebellum is the back part of the brain, controlling balance, coordinated movement, and spinal muscles. H. pylori. We can run a test for H. pylori bacteria to determine any problems related to the gut function. Neurotransmitters. We test for decreased brain neurotransmitters. Neurotransmitters are vital for proper brain function. Decreased neurotransmitters can cause increased pain. Hormone panels. We can check hormone panels to determine if the patient has normal hormone levels, low testosterone or normal testosterone in males, or low estrogen progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Inflammation. Finally, we may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein. Many patients suffering from chronic health conditions suffer from inflammatory processes. Just about every fibromyalgia patient that we have treated suffers from some form of chronic inflammatory process. Once we have run the necessary tests to determine your specific condition, we can successfully treat you by a proper neurological and all-natural nutritional protocol. Again, I am Dr. Vicki Kelsey, chiropractic physician. Out of 60,000 chiropractors nationwide, I am one of only a few implementing the innovative and effective protocols used by Dr. Michael L. Johnson, board-certified chiropractic neurologist. We are part of this group which has successfully treated thousands of fibromyalgia patients over the past 12 years. Will you be our next success story?